Good afternoon, everyone. And if you are wondering why I seem to have a familiar last name, and if I also look a bit familiar to you, it is probably because you have already met my parents. And so I am Carol. I am the youngest, the favorite daughter, because I am the only daughter of Rene and Libby Perez. Yes, and I am honestly a bit nervous to be in front of you right now, so please pray for me. But I am glad that I have been invited to take part in this regional conference of PSSA, and I am glad to see Jorel once again. Allow me to introduce myself further. I am actually a guidance counselor by profession. I have been in the counseling profession for almost 7 years. I have been exposed primarily in the school setting. So I have been handling more than 1,000 students, both in the high school and the college levels. And so I believe I have always been sharing this, that one of the reasons, or probably the best reason why I am in this profession is because as I was growing up, I have been seeing my parents in their work in the family and life ministry, and they have really influenced me a lot. That is why I have wanted to be in a helping profession. Although I am in the school setting, but I have been helping out or assisting them from time to time, mainly with the conduct of counseling trainings for the Commission on Family and Life, or for PSSA. Just a little background about what I am about to share with you this afternoon. So I will be talking about the love approach as applied to the negative test client. And this is actually an introduction or an overview about sexual integrity, or the sexual integrity program. In 2010, I was blessed to be able to attend the annual conference of Heartbeat International held in Orlando, Florida. And it was there that I was able to attend the in-depth training on the sexual integrity program implementation. It was facilitated by Ms. Katie Flood, the Sexual Integrity Program Specialist of Heartbeat International. What I really appreciated about the program, well, primarily among the different programs offered by Heartbeat International, the Sexual Integrity Program was the one that captured my attention the most, because I saw it as it was what I could really apply in my work in the school setting, because we all know how the youth of today are very different, how today's generation is very different, and it is really not enough to talk to them about abstinence or to talk to them about chastity. What I appreciate the most about the Sexual Integrity Program is how it teaches the youth, or the client in general, it teaches the client not only about practicing abstinence, but it teaches you why it is better to wait until marriage, why it is better to really uphold chastity in your life. So aside from providing the what or the how, it really gives the person the why, or the reason why we really have to embrace a more godlike attitude towards our sexuality. In this talk, I will mainly be discussing first about the negative test client, and then about sexual integrity and about its application. Earlier, you have been learning about the love approach, but this time it would be applied for the negative test client. And I would like to acknowledge that the contents of this talk were based primarily on the Sexual Integrity Program Implementation Manual published by the Heartbeat International in 2007. So we will be talking first about the negative test diet. So perhaps as you have encountered earlier, a typical scenario for a pregnancy crisis center would be you would encounter a woman, or a woman would call or visit the center, and she is suspecting, or she would like to confirm if she is pregnant or not. So she is troubled about it. And what we really would have to do first is to confirm, is she or is she not pregnant? With a pregnancy test, if we find out that the result is positive, most of the time we already know what to do. So we would find out first, or if you are already practicing or aware of the love approach, we find out first how she feels about her situation, about her condition, and then we try to determine what her needs are, if she's in need of shelter, of any financial support, or any emotional support. And after that, we find out if she is also considering abortion, if she's vulnerable to abortion, and if she is so, we seek to save the unborn child by leading the client to choose life and to continue with her pregnancy. So that has been discussed by Tita Mimi. But what if the client now obtained a negative test result? So how do we now respond to a client who is not pregnant? So one could imagine, probably, if this is encountered by pregnancy crisis centers, there might be no response at all. Why? Because we might assume that since the client is not pregnant, then she is okay. Then there is no problem. Since we cater only to pregnant women in crisis, since she is not pregnant, then she is not in crisis. So we don't have to do anything. So we don't have to give any intervention. But obviously, we are now learning that this is not true. So God has brought this person, this client, this woman to you for a reason. The very act of her coming into the center is already a hint to you that she really is open to receiving help, to receiving guidance from someone. And you are actually being given an opportunity to love. Love as in to apply the love approach, or love as in the genuine kind of love that we give to another fellow human being. Before I proceed with the sexual integrity, we also know about what we call the revolving door. First, wherein the client would keep coming back to the center, coming to the center for help every time she suspects that she is pregnant. So why does this happen? Why do we have this? It is because the client hasn't changed her lifestyle, her sexually active lifestyle. So thus, she remains to be susceptible or vulnerable to getting pregnant again, or to other risks, such as acquiring sexually transmitted diseases, and so on. So what one would really need to do is to introduce the client to a new kind of thinking, a new attitude, or a new lifestyle. And that would now be what we would call sexual integrity. I really have a código here because I don't want to miss out on anything important. I would want to make sure that I could be able to impart this message to all of you clearly and completely. Okay, so pardon the use of my código. Okay. So let us find out, or let us have the definition of the definition first of sexual integrity. So sexual integrity is expressing your gift of sexuality throughout life. So sexual integrity is expressing the gift of sexuality throughout life in a true, excellent, honest, and pure way. So if we would look at this definition, we can try to understand it na himay-himayin po natin siya, part by part. So looking at the terms used, sexual, when we say sexual, this of course pertains to, it involves both sexes, male and female. And when we talk about integrity, it speaks about wholeness, or about being free from injury or damage. So sexual integrity also pertains to sexual wholeness. And it is expressing your gift of sexuality. So we understand now that sexuality or sex is what we are and not what we do. So when we talk about sexuality, it is our maleness and femaleness. And we consider this really as a gift from God. So its expression is supposed to be true, excellent, honest, and pure. If we try to understand these words, when we say true, it means that something is authentic, something is loyal, or faithful. So imagine having these words connected to one's concept or idea of sexuality. It is something true. It is something excellent, extraordinary, or remarkably good. Honest. So it is morally good or free from deception. And something pure, which is free from anything inferior. So it is really about, again, what I have been mentioning earlier. It's not just a typical abstinence or chastity program. It's not just telling a person not to have sex before marriage or to wait until marriage. But it's really getting the person to value and appreciate and understand what his or her sexuality really means, so that he or she would give it more importance. So we also say that sexual integrity is protection in adulthood, this direction in adolescence, and celebration in adulthood. So when one is able to embrace sexual integrity from childhood, if you are introducing it or trying to get a child to value, it is meant to be protected. And for adolescents, adolescents can be guided or directed when they really understand what sexual integrity is, so that they could celebrate their sexuality at the right time, and that is when they reach adulthood, or of course within the context of marriage. So where did this idea about sexual integrity come from? So sexual integrity is based on what we could call God's blueprint or God's original plan, because we said that this is a gift, right? So God has a plan. God has a plan for life, for love, and for our relationships. He is actually our model when it comes to this, and He has also bestowed these gifts to us. So we will find that there's a scriptural basis from where we could hope this concept of sexual integrity. So first, we find from Genesis chapter 1 verse 27, it is said that God created man in His image. In the divine image He created him. Male and female He created them. So here it is emphasized how we are different as males and females, and the importance of understanding how to have healthy relationships. Another pillar would be trying to understand marriage. That marriage is, as the Bible says, that is why a man leaves his father and mother and clings to his wife, and the two of them become one body. So we teach the client also to understand what marriage really is and what God's plan for marriage really is. A third pillar would be an appreciation of our fertility. So we acknowledge that the gift of life in our bodies is our fertility. And it is actually God's mandate that we be fruitful and multiply. But of course, one really would have to know or be educated properly about one's fertility so that we would gain, again, appreciation. So it would lead us to value it, so that when we value our fertility, we won't just do anything irresponsible with it. So it would lead us to make healthier or better choices concerning our fertility. Fourth would be there's a focus on healing and restoration, particularly for those who are experiencing sexual brokenness. So in sexual integrity, again, we consider it as synonymous to having sexual wholeness. So it is when we are whole that we are most happy and most fulfilled. And everyone would want that. This is God's plan for everyone. This is meant to be embraced by everyone. So how do we introduce now this concept of sexual integrity to a negative test client? And if we would apply the love approach, how would it proceed? How would it go? So first, upon entertaining the client, or once she has received or she has found out that her test result is negative, so what do we do? Do we just allow her to go and see you don't have any problem anymore, and you can celebrate now and go on with your life? You're not pregnant. Congratulations. Is it something like that? Is that what we are supposed to do? It is your opportunity. It is now your opportunity to talk to her and try to assess by asking her these questions. How do you now feel about your negative test result? Try to lead her into thinking your future would have looked really different if that test result had been positive, right? Imagine, ibang-iba yung buhay mo. Nagkataon lang po na hindi, na negative kasi yung result. But then her life would be really different if the test had turned out to be positive. But now that it is negative, wouldn't you want to take this time to now think about your future? The future that you really want for yourself, the kind of future that you would want for your children. We try to get her to talk about what her hopes, dreams, and goals in life are. It is very important. This would be for a counseling relationship, it would be a time wherein you would really have to establish rapport with the client. Try to build a relationship with the client. You do whatever you can at this point to make her feel comfortable, to show to her that you really are genuinely concerned and that you really care for her, so that she would feel that she's welcome to stay and she would feel comfortable enough to discuss these things with you. And for all you know, she at this point, she is still feeling really confused. And even just having someone to talk to about what confuses her, it would really be a big help. It would be a big help already. So if you are able to meet the client's needs, or if you can become what she needs, especially at that point in time, then the more likely that you would get this client to come back to you. Maybe the following week or for another session. It depends on how you would set things or what the structure is in your center. So that is applying love, so that is listen and learn. Listen and learn to the negative test client. So for the O is for opening options, open options. Now that you have discussed, if she has opened up to you what her hopes, goals, and dreams are, we can ask her and try to find out how can she achieve these hopes, goals, and dreams. So what does she intend to do? Or what is she currently doing in order for her to attain those goals that she has for herself? We can try to find out, does she think that her actions are helping her to meet those goals? Or, especially in the case of her being sexually active, could this path or could these consequences be hindrances for her? Could these be hindering her to attain or to achieve those goals and dreams that she has for herself? So what could she probably do differently? So what kind of choices is she making right now? Are those choices doing her good, or is it leading her to more risk or more harm for herself or for her life or for her future? So perhaps, especially if she realizes that her practices right now could be unhealthy, then perhaps she could consider doing something different, doing things differently, and again embracing a new path, a new approach, or a new lifestyle. So this is now when you can share for the V, the vision and the value, where we can incorporate the concept of sexual integrity. So we can share now with the client the true meaning of sexuality, the message of sexual integrity, and of sexual wholeness. And we emphasize that they may be feeling, or she may be feeling, unworthy right now. If she is in guilt about, or if you're talking about sexual integrity and purity, would lead her to feel guilty about what she has been doing or the choices that she's been making in her life. We emphasize that it is not too late. She is still, she is worthy, and she can always make that choice to change and try to adapt now this new lifestyle of living out sexual integrity. And for the E, we extend and enable. Of course, we do not expect that the client would be able to absorb or to accept this new concept of sexual integrity in just one meeting or one session, especially if being sexually active has been a practice or her lifestyle for so many years. It has probably also become a habit, and as we all know, a habit would be difficult to break. So it would really have to it would really be a seed that would have to be planted in the client. It would be a seed planted in the client that she would be led to accept or to understand or at least consider at first this sexual integrity. And we encourage her that should she feel that she again needs to talk to someone, it doesn't necessarily have to be she doesn't necessarily have to be pregnant again for her to be attended to in the center. But anytime that she would feel that she would like, especially to continue to talk about this, we can invite her again if she's willing to set a schedule right away, right then and there. We take that opportunity. You offer, if she would want future talk sharings, she would want to consult, or if she needs encouragement, more support, we extend our help. We still maintain that she can come to us. And of course, we do not, if we see in her that she is resistant, which would be a typical reaction. If she is resistant, we don't give up right away on a client or on a person. So we still find ways. Maybe we can conduct follow-up. Maybe we can initiate checking on her. Even just a simple call or follow-up if we have her contact details. Kumusta ka na? How have you been since the last time that we have talked? Or maybe you would want to talk again. We could meet at another time and you can set another schedule. So follow-up is really very necessary. Because, again, sexual integrity is not just a one-time, one-shot lesson to be imparted on the client. This, as you encountered earlier, this is actually a program. This is a program. So what I mentioned here about using the love approach, what we covered is just the first interview after she had that negative test result. So several follow-up sessions would really be necessary. So I have here with me, I would just like to show to you some of the materials that Heartbeat has, because they are very generous in sharing these materials with us so that we could learn how to implement the sexual integrity program in our centers. So if you would want to learn more about really what the entire sexual integrity program is, as prepared by Heartbeat International, they actually offer a wide variety of materials that you can use in your centers as aids in conducting the interviews or the sessions with the negative test client. Or any client, because actually sexual integrity does not only apply to a negative test client, but it can also be taught to a positive test client, or as she is going through pregnancy, especially if the client is not married. So we can use this to provide better assistance to the negative test clients. And marami pong inserts kasi maraming materials talaga. So I would just like to show to you, this is the manual, the implementation manual that they have. It explains here the entire philosophy or the rationale or the concepts that they have about the program, and a lot of materials, handouts, and exercises, which of course would have to be studied very well by the volunteer to be able to effectively use them for our clients. Aside from handouts, they have brochures, DVDs, presenting the different teachings or books for further study that a client could use as you impart to that client the message of sexual integrity. For example, if we could refer to the first part, remember that in the first part of the listen and learn, we try to first get what or how the client thinks about her future, what she says, what hopes, dreams, and goals she has. So they have, for example, one material would be a handout, a checklist, wherein the client could see if these goals would fit her idea of a positive future, having good physical health, a good job, good relationships, marriage, children. So it's an instrument that could be used to get the client to think. At least get her to reflect. And for her eventually to understand that her choices would affect her future and as well as the future of his or her child. They have several materials for that. Or the benefits of marriage. So these can be considered by the client as healthier. Marriage is indeed a healthier option to what she is currently practicing right now. They really have a lot of resources that can be used by centers. And then also assessment tools to get the client to think whether the relationship that she is currently in, if it is a relationship that is worth keeping, or if it is actually a relationship that is not healthy, hence she should consider ending it. Those kinds of options or ideas to really get the client to think and consider. Example of the books that they have as part of the program, which could be used for study, would be The Love Languages by Gary Chapman. I believe you might have encountered these books. When God Writes Your Love Story. So it's about the ultimate approach to guy-girl relationships. Or really trying to get God's point of view. Or waiting for God's best for your life instead of trying to control your love life. It's surrendering the control to God. And for male and female differences, you have single men are like waffles, single women are like spaghetti. So these are just examples of materials wherein the client can get good insights and continue to get that appreciation for sexual integrity. So what could be benefits? Just some of the benefits of teaching or introducing the sexual integrity or sexual integrity program to the negative test client. So it's really about empowerment, empowering that woman. Again, you are not making the choice for her, but we are presenting this to her with the hope that she would be led to make that choice on her own, and that she would make healthier and better choices. So the negative test client will choose healthier relationships that will strengthen her current or future marriage relationships. She will be empowered to respect her body and make better choices with it with regards to fertility. She will be empowered and educated to make healthier choices. Specifically, reducing the choice of reducing sexual activity outside of marriage. So these are just some of the benefits that we would be able to see in our clients if they would be introduced to sexual integrity. So I would just like to end or to leave you now with this call and with this challenge. So it is said that we should all be extremely proud of the work that has gone on in pregnancy resource centers, because we believe that even if it is just one baby at a time, pregnancy resource centers or pregnancy crisis centers have already been doing a lot. But perhaps we can expand the work and do more by reaching out and trying to help out now, even with the negative test clients. So with that, I would like to thank you all for listening, and may God bless you in your ministries.